Hi guys, and welcome to this screencast on the anatomy of the bone. So in our last lesson we looked at types of bones. We looked at long bone, short bone, flat bone, sesamoid bones and irregular bones, and we kind of learned how to describe them and then the function as well as giving examples for them. So in today's lesson we're going to be talking about the anatomy of long bones in particular. Okay, so your Cornell notes need to look like so. So remember, we have articular cartilage as an example. We will write about articular cartilage underneath this, and then the question here that you are going to write has to give you the answer articular cartilage using key terms from the description. If your key questions are not done, you will not be entering the classroom. Please ensure you do this properly. I do not want to get in a situation where I'm kicking some of you out. So first of all, if we move on to the left hand side, you've got a kind of an image of showing you each key term that we're just about to be learning, and then I'm going to give you the description. So articular cartilage, as you can see, is found at the end of the bones, and it is there to shock absorb and then also to reduce friction when we're moving. Okay, so found at the end of a long bone, reduce friction during movement. So that is what our articular cartilage is. The end of every single long bone has articular cartilage. Okay, so we have this red bone marrow here. So red bone marrow, what that is, produces red blood cells, white blood cells and platelets. So red blood cells, really important because they carry hemoglobin, which carries oxygen. We have white blood cells are there to fight infection and to destroy bacteria, and then platelets help clot blood. We'll learn about these in a bit more detail later on in the unit. So medullary cavity, so the cavity where bone marrow is stored. Okay, so with the red bone marrow we also get yellow bone marrow, and this is responsible for producing fat and cartilage, and it's kind of like a spongy tissue, as you can see here. Okay, so then we also have compact bone, which is this kind of like secondary layer that we have here, and again this is hard tissue surrounding the bone. It's also known as a cortical bone. Finally, for this little first section, we've got periosteum here, and this is just the outer layer. Okay, so it's a tough outer layer of bone. So if I was going to give you an example for one of the questions, I would say, first of all, do a description of articular cartilage. Then I would say something along the terms of which A/C is found at the end of long bones and it reduces friction during movement. The answer, articular cartilage. That is what we're looking for when we're doing our Cornell notes. Okay, so the next section, again, we have an image to the left here. This may come in useful because it could be a fill in the blanks when it comes to your exam paper, so you need to know and see where each one lies. So proximal and distal, so we should know this with regards to anatomical terminology. Proximal is close to the origin and distal is far further away from the origin. So we have proximal and distal epitheses, which again are here and here, and what we have is they're just the rounded end of the bone and they articulate with another bone in a joint. For example, for the radio-ulnar joint or the humeroradial joint, that is where the bones will articulate. Within the bone itself we also have blood vessels. Now blood vessels will carry nutrients and minerals towards the bone to make the bone healthy. We have a diaphyses, which is the shaft of the bone, just here. So it's the long section of the bone. Then we have the epiphyseal line. So it's also known as a growth plate. So before we enter, well, when we're in childhood and adolescence, this growth plate here is where a bone actually grows, and then when we stop growing, the growth plate kind of turns into this epiphyseal line here. So you can see, so it's a distal cartilage responsible for bone growth. In between diaphyses and epiphyses, and is the only area where bone increases in length. When growth stops, it is replaced by the epiphyseal line. And then finally we've got cancerless bone here, which is honeycomb structure, so like a crunchy bar there, and it keeps our bone strong but yet light in weight. Okay, so they are our Cornell notes for this lesson. Please ensure you have appropriate questions and that your questions are complete, and I'll see you in the next lesson.